My name is Lindsay, and I'm from Ohio. I would describe myself as a lover and a fighter. I am just a complete open heart and always have been. And then I love to laugh, and I love to make other people laugh. Everybody has something in their life that they have to overcome, so that's the fighter part. I started seeing HS symptoms in about my mid-20s. I was working, I was trying to have a social life, I was dating. I started getting smaller abscesses, and then they started getting larger and more frequent. I wasn't sure what it was. I had never even heard of HS before. I went to my doctor thinking that what I was experiencing were ingrown hairs. She initially agreed with me, and then the abscesses just kept coming. They would be worse. There would be multiple at the same time. And then she was like, okay, this is a little bit out of my scope, so I'm going to refer you to a dermatologist. Immediately, once they saw, they knew. My dermatologist explained it to me as this is an inflammatory condition. The one that you have is HS. I tried steroids, I tried antibiotics, I tried drawing salves, I tried different laundry detergent. My doctor decided to start me on biologics when everything else failed. And then they were like, hey, Cosentyx was just approved for people with HS. Do you want to try it? And I was like, lay it on me. I was initially a little nervous about injecting myself, but dude, it's not even a thing. It's just like every other medicine that I take. On my about third loading dose of Cosentyx, my abscesses were starting to dry up. Whoa, this is actually working. I was able to do things that I hadn't done in years. I was able to swim. I was able to ride a bike. I was able to wear tight-fitting clothing if I wanted to. I love thrifting, and so does my best friend. Before Cosentyx, I would have to worry about, an abscess rupturing, and now I can go thrifting the whole day. My HS tattoo, it's going to be ferns that wrap around my neck like my little suit of armor that everybody can see and know that I just went through battle with HS, and now I just get this beautiful piece of artwork. I just love living my life without an anchor. It is just mind-blowing how quickly it worked for me. It's so nice just to reclaim my style. I feel like myself again.
Indications. Cosentyx, secukinumab, is a prescription medicine used to treat people 6 years of age and older with moderate to severe plaque psoriasis, PSO, that involves large areas or many areas of the body, and who may benefit from taking injections or pills, systemic therapy, or phototherapy, treatment using ultraviolet or UV light alone, or with systemic therapy. People 2 years of age and older with active psoriatic arthritis, PSA, adults with active ankylosing spondylitis, AS, adults with active non-radiographic axial spondyloarthritis, NRXPA, and objective signs of inflammation. People 4 years of age and older with active enthesitis-related arthritis, ERA, adults with moderate to severe hidradenitis suppurativa, HS. Important safety information. Do not use Cosentyx if you have had a severe allergic reaction to secukinumab or any of the other ingredients in Cosentyx. See the medication guide for a complete list of ingredients. What is the most important information I should know about Cosentyx? Cosentyx is a medicine that affects your immune system. Cosentyx may increase your risk of having serious side effects, such as infections. Cosentyx may lower the ability of your immune system to fight infections and may increase your risk of infections. Some people have had serious infections while taking Cosentyx, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses. Some people have died from these infections. Your doctor should check you for TB before starting treatment with Cosentyx. If your doctor feels that you are at risk for TB, you may be treated with medicine for TB before you begin treatment with Cosentyx and during treatment with Cosentyx. Your doctor should watch you closely for signs and symptoms of TB during treatment with Cosentyx. Do not use Cosentyx if you have an active TB infection. Before starting Cosentyx, tell your doctor if you are being treated for an infection, have an infection that does not go away or that keeps coming back, have TB or have been in close contact with someone with TB, think you have an infection or have symptoms of an infection such as fevers, sweats or chills, muscle aches, cough, shortness of breath, blood in your phlegm, weight loss, warm, red, or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate, or urinate more often than normal. After starting Cosentyx, call your doctor right away if you have any signs of infection listed above. Do not use Cosentyx if you have any signs of infection, unless you are instructed to by your doctor. What are the possible side effects of Cosentyx? Cosentyx may cause serious side effects, including serious allergic reactions. Serious allergic reactions can occur. Get emergency medical help right away if you get any of the following symptoms: feeling faint, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing or throat tightness, chest tightness, skin rash or hives, red itchy bumps. If you have a severe allergic reaction, do not give another injection of Cosentyx. Inflammatory bowel disease. New cases of inflammatory bowel disease or flare-ups can happen with Cosentyx and can sometimes be serious. If you have inflammatory bowel disease, ulcerative colitis, or Crohn's disease, tell your doctor if you have worsening disease symptoms during treatment with Cosentyx or develop new symptoms of stomach pain or diarrhea. Severe skin reactions that look like eczema can happen during treatment with Cosentyx from days to months after your first dose and can sometimes lead to hospitalization. Your doctor may temporarily stop treatment with Cosentyx if you develop severe skin reactions. Tell your doctor if you have any of the following signs or symptoms: redness or rash, itching, small bumps or patches, your skin is dry or feels like leather, blisters on the hands or feet that ooze or become crusty, or skin peeling. The most common side effects of Cosentyx include cold symptoms, diarrhea, and upper respiratory tract infections. These are not all of the possible side effects of Cosentyx. Call your doctor for medical advice about side effects. Before using Cosentyx, tell your doctor if you have any of the conditions or symptoms listed above for infections. Have inflammatory bowel disease, Crohn's disease, or ulcerative colitis. Are allergic to latex. The needle cap on the Cosentyx Senza-Ready pen and 150 mg per milliliter and 75 mg per 0.5 milliliter pre-filled syringes contains latex. Have recently received or are scheduled to receive an immunization, vaccine. People who take Cosentyx should not receive live vaccines. Children should be brought up to date with all vaccines before starting Cosentyx. Have any other medical conditions and all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Keep a list of your medicines to show your healthcare provider and pharmacist when you get a new medicine. Are pregnant or plan to become pregnant. It is not known if Cosentyx can harm your unborn baby. You and your doctor should decide if you will use Cosentyx. Are breastfeeding or plan to breastfeed. It is not known if Cosentyx passes into your breast milk. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including medication guide.